A lot of photographers, they seem to like edit my nose when I smile. And I don't have a problem with my nose. It's just for the work that I want to do, my nose seems to be a concern, like a big concern.
These bones are wide. When I bring them in, they'll give me a little bit of height increase in this area. So her profile will increase a little bit, but my goal is really mostly to work here and just narrow this aesthetic line of the bridge, which is wide.
One of the main things that I do not like about my nose is like when I smile, it just spreads and spreads and spreads.
The flaring out here needs to come inward. She has a little bit of flatness here, but not as bad as I usually see. Usually with African American noses, this area is completely flat. So this is really dipped in, and so you see a lot of their nostrils. See, most are like this. With her, you don't really see that, which makes my job a little bit easier in this area. So I'll add a little bit of cartilage here, enhance and refine her tip. The aesthetic lines that come from the eyebrows down the nose are going to be narrowed in a very natural way.
I'm totally comfortable in being in my own skin. I just want to feel 100% no matter, what it is.
This natural curve here needs to be maintained in an African American rhinoplasty. If you cut this too much off, then the nose will look triangular and it'll look very fake, over-operated, and does not look natural at all. So by retaining this curve here, she'll have a very natural aesthetic result.
I just want my nose to look natural, and I'm really confident that he will make me look very natural. And I'm just expecting like a minimal change. I don't want it too drastic, but definitely small and natural looking.
Hello, how are you? Good morning. So you're all ready?
Yes, I am.
Okay. Mark your nostrils. I'm going to bring the nostrils in. And that's going to do a lot for you. And I'll do it in a very natural way so that when they get narrowed, they still have that curve to them. That's very important. So it's not triangular.
Yes.
Okay?
Okay.
All right?
I trust you.
Sure. All right. See you in a sec.
Okay, see you.
So if you look right here, you can see how she's narrowed here. So we brought her already her bridge in, and you can see this is how narrow she really is. So you can see the difference in the nostrils here. I brought this one all the way in. This one I still have to cut. And this is narrow. This tip's going to be cute, projected, refined. And this nostril still has a nice curve to it.
What I like about my new nose is that the doctor did exactly what I asked him to do.
So our African American patient did very well from her rhinoplasty. It's exactly what I wanted and it's what she desired. Very natural changes were accomplished, including bringing in the flare of her nostrils down. So she has a very narrow nostril, but yet it's natural and still has a natural flare to it. So it's not triangular and fake looking. The other thing that we did is her bridge, we narrowed in, and it does not look so narrowed where it looks like there's a pipe coming down the nose. It does not look like a rhinoplasty was accomplished or done on this patient.
Dr. Ghavami has really helped me because he was not a doctor who just said like, come in, let's do the nose and get it out the way. He more so sat me down, looked at what I was doing with my career, looked at my facial features and matched everything to my face. So I'm very, very happy and fortunate to find a doctor like him.
And that's what I shoot for when I do any rhinoplasty, whether it's African American, Asian, Hispanic, Middle Eastern, Caucasian. The whole point is to make it look like nothing was done, and that patient was just lucky to be born with such a good nose.